First thing I would like to do is just acknowledge that I'm on the traditional lands of the Lekwungen and the Wasanich peoples, and I'm very grateful to have the opportunity to live in this beautiful space. So I'm situated in what is commonly referred to as Victoria, and my name is Ingrid Handlovsky. I completed my PhD at the School of Nursing at UBC in the spring of 2018, and my research focus and just my passion generally is health equity. An overarching focus. I'm really interested in examining how structural conditions, so our social milieus, historical, political, how that influences our health perceptions and our health practices. But particularly with an eye to looking at how those structural conditions can contribute to disadvantage for groups of people. And as health professionals, looking at how do we redress that structural level discrimination and interpersonal discrimination that happens to better health outcomes for people. And I've been working as a continuing faculty at Camosun College, but I'm very excited that I have had an opportunity to take a new position, and that will be at the University of Victoria starting next month as an assistant professor in the School of Nursing. My recent publication comes from my dissertation, and I did a paper-based dissertation. So I took the data and I looked at three kind of distinctive angles from which to talk about. So the overarching focus of my dissertation was looking at middle-aged and older gay men's health and illness practices in the context of homophobia and heteronormativity. So this particular paper was the second of the three papers that I wrote, and it was the most intense and the most theoretically dense, because what I really focused on for this particular paper was looking at what are the processes by which men manage their health, but I wanted to understand that by situating those processes of health management in the broader context of their social and historical day-to-day lives. Because if you think about middle-aged and older men who I always say self-identify as gay, just at the outset, I won't keep repeating that, but just to make sure that people understand that that was the language that the participants had preferred to use. So they self-identify as gay, I'll refer to as gay men from here on in. The age range was 40 to 76. So these were men who lived through the HIV era of the 90s, relentless discrimination and a lot of complicated health issues. And so I wanted to understand those pieces. I wanted to appreciate those pieces and understand how that played out in health management. And I defined health management as the variety of social practices geared towards maintaining health and navigating health challenges. So really just sort of situating this in this really broad and quite complex social environment and how that played out how those pieces influenced health management processes. So that was the second paper, and that's I've actually published now, which is really exciting, all three papers from the dissertation. But that was the focus, was really looking at a grounded theory. I drew on grounded theory methods to come up with this theory of health management.